8 types of vegetables seniors should avoid. The 7th one will surprise you. Hello everyone, welcome to the channel. Today, we're going to discuss a crucial topic for our beloved seniors: nutrition. While it's well known that vegetables are good for health, some of them may not be as beneficial as we age. In fact, certain types of vegetables could pose unexpected health risks for older adults. We'll explain why some of these vegetables may no longer be the best choice for you and provide better alternatives. If you're new here, you can show your support by clicking like and subscribing to the channel. Don't forget to turn on the notification bell to stay updated and leave your location in the comments below. Let's get started. Let's begin with spinach. This vegetable is an excellent source of vitamins and minerals, but it also contains a significant concentration of oxalates. When consumed raw, these natural compounds can be risky, especially for seniors prone to developing kidney stones. Oxalates can bind with calcium in the urine, increasing the likelihood of forming painful stones. People with a history of kidney problems should be extra cautious with foods high in oxalates. However, the issue doesn't stop at kidney stones. Oxalates can also interfere with calcium absorption, a key nutrient for bone health, which becomes even more crucial as we age. Another important factor to consider is that individuals taking blood thinners like warfarin should be mindful of excessive consumption of vitamin K-rich foods, such as spinach, as they can affect the effectiveness of these treatments. It's advisable to consult your doctor about your diet, especially if you are on medication. Now, let's talk about sprouts. While they might seem like a healthy and refreshing choice, they can pose certain risks for older adults. Sprouts, such as alfalfa and soybean sprouts, or any type added to salads or sandwiches, provide the perfect environment for bacterial growth. Because they require warm and humid conditions to grow, sprouts can harbor harmful pathogens like E. coli and salmonella. For seniors with a weakened immune system, these bacteria can be a serious threat to their health. Food poisoning is a severe condition that can lead to significant complications, especially in older individuals. Even though sprouts may seem harmless, it's important to be cautious and avoid consuming them unless they are properly prepared. Some of you might be attached to your sprouts, which is understandable, but it's essential to cook them thoroughly before eating. Cooking eliminates harmful microorganisms, ensuring that your food is safe to consume. Corn on the cob. Now, let's talk about one of the most popular seasonal treats: corn on the cob. Who doesn't love this delicious, crispy, and juicy snack? However, over time, corn can cause certain issues. The first concern is digestion. Corn has a tough outer layer made of cellulose, a type of fiber that our bodies struggle to break down. As we age, digestion naturally slows down, making it even harder to break down cellulose. This can lead to discomfort, bloating, and gas. The second issue is that corn is high in carbohydrates, which can be problematic for older adults, especially those who need to manage their blood sugar levels. Excessive carbohydrate intake can lead to blood sugar spikes, which pose a challenge for people with diabetes or prediabetes. I'm not suggesting that you completely eliminate corn from your diet. If you enjoy it, go ahead and eat it in moderation. Just pay attention to portion sizes and monitor how your body reacts. Chapter 4. Kale, an underrated vegetable. Kale is a leafy green classified as a superfood. However, it is not necessarily beneficial for everyone, particularly seniors. Like spinach, raw kale contains oxalates and chemical compounds that may promote the formation of kidney stones and hinder calcium absorption. However, there is another component in kale that deserves attention: goitrogens. Goitrogens are substances that can interfere with thyroid function by blocking its ability to use iodine, an essential element for producing thyroid hormones. Older adults at high risk of developing thyroid issues may find that excessive consumption of raw kale worsens these symptoms. However, before eliminating it entirely from the diet, it is important to note that cooking significantly reduces oxalate and goitrogen levels. Before we continue, remember to give this video a like if you're enjoying it and subscribe to the channel for the best tips on attracting abundance and prosperity into your life. Let's move forward. Chapter 5. Asparagus, a hidden diuretic. Asparagus, those slender green stalks, may seem like a simple addition to your meals. However, for seniors, there are some factors to consider. Asparagus contains purines, natural compounds that the body converts into uric acid. When uric acid levels are too high, they can lead to an uncomfortable condition known as gout. Gout is a form of arthritis that causes inflammation and pain in the joints, with the big toe being one of the most commonly affected areas. Those with a history of gout or a predisposition to developing it should consume asparagus in moderation. On the other hand, asparagus has diuretic properties, meaning it promotes the elimination of excess water and sodium through urine. While this effect may be beneficial for some, it poses a risk for seniors, who are already more vulnerable to dehydration. Chapter 6. Mushrooms, Deceptive and Dangerous. Let's talk about mushrooms. They add a unique umami flavor to dishes, but not all types of mushrooms are created equal. Some can be extremely dangerous. Wild mushrooms, in particular, can be toxic. Certain varieties contain poisons that can cause severe illness or even death. It is crucial to purchase mushrooms only from reliable sources, such as grocery stores or local markets. However, even store-bought mushrooms should be handled with care. Mushrooms contain a chemical called agarotine, which has been linked to cancer in animal studies. Although research on its effects in humans is still ongoing, it is best to err on the side of caution. Cooking mushrooms effectively breaks down agarotine, making them safer to eat. So, always ensure they are fully cooked before consuming. Chapter 7. The Impact of Potatoes on Blood Sugar Levels. Potatoes are a staple food, but they may not be the best choice for seniors, especially regarding blood sugar management. Due to their high glycemic index, potatoes can cause a rapid spike in blood sugar levels after consumption. This can be problematic for seniors with diabetes or prediabetes, as well as for those looking to maintain a healthy weight. Another issue with potatoes is the formation of acrylamide. This compound develops in starchy foods, like potatoes, when they are cooked at high temperatures, such as frying or baking. Although more research is needed, some studies suggest that acrylamide may be carcinogenic. To minimize acrylamide production, it is best to avoid overcooking potatoes. Chapter 8. Peas, Small but Powerful Sugar Sources. Finally, let's talk about peas. Despite their innocent appearance, these small green vegetables can have a significant impact on blood sugar levels. Peas contain a considerable amount of carbohydrates and, like potatoes, have a high glycemic index. This means they can cause a rapid spike in blood sugar levels, which can be concerning for seniors, especially those managing diabetes or prediabetes. In addition to their carbohydrate content, peas also contain purines. As mentioned earlier, purines break down into uric acid in the body, and elevated uric acid levels can lead to gout. People with a history or risk of developing gout should consume peas in moderation. So, these are 8 vegetables that seniors should avoid or consume with caution. It's important to understand that everyone is different, and what works for one person may not work for another. It's always best to seek guidance from a qualified doctor or dietitian to develop a personalized nutrition plan that meets your individual needs. Do you regularly include any of these vegetables in your diet? Please share your thoughts in the comments below. If you found this video helpful, type yes in the comments. This really supports me. For more healthy aging tips, don't forget to check out the 2 videos I left earlier. Thank you for watching, and I look forward to our next interaction. 8 types.
If you are 65 or older, showering daily could pose a risk to your health. Did you know that the habit of constant personal hygiene might actually have negative effects on your well-being? Throughout my 4 decades of experience as a doctor, I have treated numerous elderly patients who have faced serious consequences due to this practice. Though it may seem unbelievable, this is a fact supported by medical science. Every winter, cases repeat of older adults fainting in the shower, suffering fractures, or even passing away. Yet, many seniors continue the habit of bathing with hot water every day. Why this insistence? If your parents have the habit of showering daily, I recommend you watch this video to the end. This information can make a difference, and might even save a life. Before we begin, remember to subscribe and leave a like. Your support is truly valuable to me. Now, I will reveal 5 surprising truths about bathing that every person over 65 should know, backed by my 40 years of experience in medicine. First truth: hot water bathing can be dangerous for the heart. Have you ever wondered what happens to your body when you immerse yourself in hot water? Based on my 4 decades experience as a doctor, I have observed that hot water causes rapid expansion of blood vessels, which can lead to a sudden drop in blood pressure. For those over 65, especially those with hypertension or heart conditions, this can pose a lethal risk. Every winter, I treat at least 10 elderly patients who faint in the bathtub due to this condition. For example, Mr. Smith, a 90-year-old man, had maintained a habit of showering with hot water every day for over 6 decades. He used to say, "Dr. Gustavo, I owe my well-being to my daily baths." However, one winter, while bathing, he suffered a heart attack. Fortunately, his family found him in time, allowing him to survive, though he had to spend a long period in intensive care. From a medical perspective, people over 65 experience a decline in the autonomic function of their nervous system, reducing their ability to adapt to sudden temperature changes. When stepping out of a hot bath, blood pressure can drop abruptly, causing orthostatic hypotension. In fact, staying in water hotter than 41 degrees Celsius, 105.8 degrees Fahrenheit for more than 15 minutes can increase cardiovascular strain by 20 to 30%, equivalent to the effort of light jogging. But don't worry, here's how to bathe safely. Water temperature should not exceed 38 to 40 degrees Celsius, 100 to 104 degrees Fahrenheit. An effective way to check is by using the back of your hand. If it feels pleasantly warm, the temperature is correct. The ideal shower time should not exceed 10 minutes. Based on my research, this is the optimal duration to minimize strain on the cardiovascular system. Drink an adequate amount of water before and after bathing to prevent excessive drops in blood pressure. Place a chair in the shower and sit while bathing. This significantly reduces the risk of falls. Avoid bathing alone, especially if you're over 80. Ensure someone is nearby in case of an emergency. Second truth: daily bathing dries out the skin. Throughout my career, I've had the privilege of treating thousands of elderly patients, and I've observed that natural skin oil production declines with age. By 65, the skin generates half the lipids it did at 20. Now, imagine combining this with daily hot showers. What are the consequences? Last month, I treated Mrs. Maria, a 78-year-old woman who experienced severe itching after every bath, keeping her awake at night. Upon examining her skin, I noticed extreme dryness and small cracks. She asked me, "Dr. Gustavo, I've always bathed carefully with soap. Was I doing something wrong?" Unfortunately, yes. For older adults, daily soap use damages the skin's natural protective barrier. In fact, a dermatological study found that people over 65 who use soap more than 4 times a week have a 60% higher risk of skin dryness. Dry skin isn't just uncomfortable. It can cause intense itching, and scratching can lead to wounds that increase infection risks. I've hospitalized patients due to infections from post-bath scratching. Here's how to maintain healthy skin. Reduce bathing to 3 times a week, allowing the skin to restore its natural oils. Use soap only on essential areas, armpits, groin, avoiding full body application. Choose soaps with a pH of 5.5 to 6.0. Alkaline soaps dehydrate the skin. Apply moisturizer within the first 3 minutes after bathing. This golden window maximizes moisture retention. Opt for products with ceramides and hyaluronic acid, which strengthen the skin barrier and lock in hydration. Check labels for these ingredients. After following these steps, Mrs. Maria reduced her itching by 80% in just 2 weeks, finally allowing her to sleep comfortably again. Third truth: falling in the bathroom can be fatal. Bathroom falls are one of the leading causes of injury among older adults. Throughout my career, I've treated countless patients who suffered falls while showering. Last year, Mr. Johnson, an 88-year-old man, lost his balance stepping out of the tub and fractured his hip. Though the surgery was successful, His mobility became severely limited, drastically impacting his quality of life. Statistics show that adults over 65 who suffer a hip fracture face a 20 to 30% chance of dying within the following year due to related complications. Why are older adults at higher risk of bathroom falls? Slippery surfaces from water on the floor, sudden drops in blood pressure, and dizziness caused by hot water, age-related balance decline, reducing stability. How to prevent dangerous falls. Install grab bars and non-slip mats in the shower and near the tub. Avoid sudden movements when exiting the bath. Ensure proper bathroom lighting to avoid missteps. Use a shower seat instead of standing for long periods. A shocking statistic: 38% of senior falls happen during or right after bathing. Even more alarming, fractures from these falls significantly increase mortality rates. A study by Severance Hospital found that for adults over 80 who suffer hip fracture, the one-year mortality rate reaches 25%, meaning 1 in 4 will pass away within a year. The simplest, most effective solution? Non-slip mats are one of the most cost-effective and life-saving measures you can take. These are just 3 of the 5 critical truths about safe bathing for seniors. In the rest of this video, I'll reveal the last 2 points, including how to protect your heart and skin while staying clean. Don't miss it. 1. Install grab bars near the bathtub and toilet. These can be crucial in preventing a fall. 2. Use a shower chair. Sitting while bathing reduces the risk of falls by over 90%. 3. Move slowly before and after bathing. Avoid standing up or making sudden movements. 4. If possible, have someone assist you, especially if you're over 80. 5. My patient's grandfather implemented all these measures after his recovery and has now gone over a year without accidents. He even finds bathing while seated more comfortable. The 4th shocking truth about bathing: body temperature regulation is crucial. As we age, the body's ability to regulate temperature declines. According to my research, people over 80 have a 40% lower capacity to adapt to temperature changes compared to those in their 20s. After a hot bath, body temperature may rise momentarily, but if not regulated properly, it can drop abruptly, and that's the danger. Last January, 92-year-old Mrs. Bang took a hot bath but didn't dry off properly and remained in a cold room. As a result, she suffered hypothermia and was rushed to the hospital with a body temperature of 34.5 degrees Celsius, 94.1 degrees Fahrenheit. Her family asked me, if she took a hot bath, why did her temperature drop? The explanation is simple. After a hot bath, the blood vessels in the skin expand. If the body is exposed to cold air, heat dissipates rapidly, just like placing a cup of hot water in the fridge. To properly regulate body temperature in older adults, I recommend: pre-warm the bath water to minimize temperature variation. Dry the body thoroughly with a warm towel immediately after bathing. Moisture on the skin evaporates and can cool the body. Put on warm clothing right after bathing, ensuring the hair is completely dry. Drink a warm beverage after bathing to help maintain internal body heat. In winter, bathe between 2 p.m. and 4 p.m. when temperatures are highest. Since her recovery, Mrs. Bang has followed these recommendations and now bathes safely. Remember, regulating body temperature isn't just about comfort. It's vital for the health of older adults. The 5th truth about bathing: excessive cleanliness can weaken the immune system. Is extreme cleanliness always a good thing? Multiple studies have revealed that excessive hygiene may actually harm your health. Our skin is home to a vast community of beneficial bacteria, known as the skin microbiome, which plays a protective role by preventing harmful germs from multiplying. However, daily soap use also strips away these helpful microbes. In younger individuals, the skin microbiome regenerates quickly, but for people over 65, this process slows down significantly. In fact, A collaborative study I conducted with Seoul National University Hospital's microbiology department found that adults over 75 who showered with soap daily had a 35% weaker skin immune response compared to those who bathed only 3 times a week. A real-life example is 83-year-old Mrs. Dolores, who took pride in scrubbing herself with soap every day. She used to tell me, "The secret to my longevity and well-being is cleanliness." Yet, every winter, she ended up hospitalized due to skin infections. Her overly clean skin had tiny cracks that allowed bacteria to enter, and due to her weakened skin barrier, infections spread easily. Another study also found that older adults who shower daily have a higher risk of respiratory infections, since skin immunity is linked to respiratory defenses. But don't worry. Here's how to maintain hygiene without compromising your skin's natural defenses. Reduce soap use to 2 to 3 times a week, giving beneficial bacteria time to recover. Avoid antibacterial soaps and shower gels, as they kill both good and bad microbes. Instead, opt for mild, moisturizing soaps or pH-balanced cleansers. Use soap only on odor-prone areas, armpits, groin, and rinse the rest of your body with water. Keep indoor humidity between 40 to 60%, as dry air disrupts the skin microbiome. After following these recommendations for a year, Mrs. Dolores has had no further skin infections and maintains healthy skin despite her advanced age. Conclusion: today, we've discussed 5 key aspects of bathing. Bathroom falls are a significant risk for older adults, but they can be prevented. Regulating body temperature after bathing is essential. Excessive hygiene can weaken the skin's immune defenses. Despite these recommendations, some might still think, if I don't bathe daily, I'll feel uncomfortable and dirty. I need hot water to relax before bed. However, research and my experience as a physician show that for adults over 65, daily showers often do more harm than good. Why do so many elderly people insist on bathing daily? A generational mindset. Our parents and grandparents lived through post-war times when hygiene conditions were poor and diseases spread easily. That experience shaped their deep-seated belief in daily washing as a necessity. Social pressure and dignity. In our society, cleanliness isn't just about health. It's tied to respect and consideration for others. Many seniors fear being perceived as unclean. My 93-year-old patient used to shower twice daily, terrified her grandchildren would say she smelled old, until she collapsed from exhaustion. Emotional anxiety. Some older adults feel physically and mentally unsettled if they skip a bath, even if they're hygienically clean. Many of my patients report struggling with sticky skin and insomnia unless they bathe at least once a day. Finding the balance. Understanding these reasons is key to balancing health, safety, and dignity. The goal isn't to abandon hygiene, but to adapt it, protecting the skin's defenses while respecting emotional and social needs. Understanding psychological factors. How to support older adults in adopting healthier hygiene habits. Given these psychological aspects, here are some practical recommendations to help reduce anxiety in older adults and guide them toward healthier bathing routines. 1. Explain that bathing 3 times a week is enough. According to a Harvard Medical School study, there is no significant difference in skin bacteria levels or infection rates between older adults who bathe 2 to 3 times a week and those who bathe daily. Reassure them that less frequent bathing does not compromise cleanliness. 2. Odor control doesn't require a full shower. Daily spot cleaning of odor-prone areas, armpits, groin, and feet is sufficient. I advise my patients to wash key areas daily with a damp cloth. Take full baths only 2 to 3 times a week. Over 90% of those who followed this method reported feeling fresh and clean. 3. How to suggest changes without causing conflict. A direct approach like, "You need to bathe less," may feel critical. Instead, try, "Mom, I heard a geriatric expert on TV say that older skin is different. Overbathing can dry it out and weaken immunity. What if we tried what this 40-year experienced doctor suggests?" This frames the change as medical advice, not personal criticism. 4. Offer alternative relaxation rituals. The soothing benefits of bathing can be achieved through warm towel massages, like Mrs. Bang, 85, who uses a lavender-infused towel, sponge baths with essential oils, gentle skincare routines. These alternatives keep the skin hydrated while providing comfort. 5. Gradually reduce bathing frequency. Lifelong habits take time to change. A step-down approach works best. Start by skipping 1 bath per week. Slowly decrease to 3 baths weekly over 2 to 3 months. Mr. Kim, 78, successfully transitioned this way. His skin improved, and he felt better overall. If you know anyone over 65 who bathes daily, share these tips, especially in winter when bathroom accidents peak. Small changes can prevent falls, infections, and hospitalizations while maintaining dignity and comfort. Bathing and sleep quality in the elderly. Many believe that taking a warm bath before bed promotes rest, which is true for younger individuals. In people around 30 years old, body temperature drops after bathing, stimulating production of melatonin, the hormone responsible for sleep. However, for those over 65, the situation changes. In a study conducted by my team with 200 individuals over 75, we found that those who bathed in water hotter than 41 degrees Celsius 2 hours before bedtime experienced poorer sleep quality. The number of nighttime awakenings increased by 42%, and the amount of deep sleep decreased by 38%. This is because older adults have a diminished ability to regulate their body temperature, leading to uncontrolled internal fluctuations after a hot bath, which disrupts their rest. An example is Mrs. Lee, an 82-year-old who used to take hot baths before bed and suffered from chronic insomnia. Following my recommendation, she lowered the water temperature to 38 degrees Celsius, shortened her bath to 5 to 10 minutes, and bathed 3 hours before going to bed. As a result, she experienced a significant improvement in her sleep. Tips for the perfect pre-bedtime bath for older adults. Water temperature, around 38 degrees Celsius. Avoid excessively hot water. Bathing time, no longer than 5 to 10 minutes. Timing. Bathe at least 3 hours before bedtime, not right before sleeping. Additional suggestion. Drinking an herbal tea after bathing promotes relaxation. Alternative to a full bath. Instead of full bath, soaking just the feet in warm water can be effective. Mr. Park, a 78-year-old man, had suffered from insomnia for over 20 years. After replacing his hot bath with a warm foot soak 3 hours before bedtime, he slept deeply without medication for the first time in 2 decades. Rest is crucial for health in old age. Following the right bathing recommendations can ensure safe and restorative sleep. Summary of bathing recommendations for older adults. Frequency, 2 to 3 times per week. Temperature, between 38 to 40 degrees Celsius. Duration, no more than 10 minutes. Soap use, apply only to specific areas, armpits, groin, etc. Choose cleansers with a pH of 5.5 to 6.0. Apply moisturizer within the first 3 minutes after bathing. Bathroom safety, use non-slip mats, install grab bars in the shower and near the toilet, and consider a shower chair. Post-bath care, dry off immediately to prevent body heat loss. Skin care, avoid antibacterial soaps, opt for hydrating products. Maintain indoor humidity between 40% to 60%. Some may think, it's too late to change my habits. Yet, as a saying in traditional Chinese medicine goes, the best time to plant a tree was 20 years ago. The second best time is now. By following these science-backed guidelines, older adults can significantly improve their health and well-being. If you found this information helpful, don't forget to subscribe and hit the like button. Turn on notifications to be the first to access more content on healthy aging. Thank you. Have you ever heard of the so-called third age scent? It may sound harsh, but it's a real thing and affects most people over 60. What's surprising is that it's not just related to hygiene, but to a transformation in the body that isn't visible to the naked eye. If you've noticed an unusual or damp smell on your skin, clothes, or even on your pillowcase, don't ignore it. It's a sign that something else is happening. The good news is that you can stop it and even reverse it if you act quickly. Stay with me, because soon I'll share 5 essential steps you should follow immediately to eliminate that odor and keep your body fresh, clean, and healthy. Why does this strange odor occur? Experts call it non-nenal, and it arises when the skin produces a higher amount of fatty acids, while its antioxidant reserves decrease. This phenomenon intensifies as the years go by, particularly after the age of 60. As a result, an odor appears that is usually associated with dampness, grease, or a slight acidic note. The most annoying thing is that this odor clings to clothes, sheets, and furniture. Even after showering, it may persist. But the real issue isn't just a change in smell. It also indicates that your body is having difficulty processing certain toxins and fats, which, if not managed properly, could lead to other health problems. What can you do about it? Let's explore 5 actions you should take immediately. 1. Choose a pH-balanced soap. Many people think soap is just that. Apply it, rinse, and problem solved. However, after the age of 60, the body undergoes subtle transformations that might go unnoticed, and the soap you've used for years may no longer be effective. The skin produces natural oils to retain moisture, but over time, these oils break down differently. Instead of contributing to a fresh feeling, they combine with oxygen and bacteria, creating that characteristic age-related odor, which lingers even after bathing. The problem is that regular soap doesn't have the strength to stop it. The solution is a shower gel with a balanced pH. Unlike harsh soaps that dehydrate the skin, it works in harmony with it, neutralizing the compounds that cause the bad odor instead of just masking them. Essential ingredients to look for. Heavy checkmark green tea helps eliminate toxins from the skin. Heavy checkmark activated charcoal captures the oils that cause bad odors. Heavy checkmark citrus extracts combat damp smells and replace them with fresh, natural fragrance. Expert suggestion: don't rush to rinse. Let the soap sit on your skin for at least a minute before rinsing to ensure it works. Also, it's recommended to avoid hot water, as it removes beneficial natural oils and can intensify the odor over time. Opt for lukewarm water. With this simple adjustment, you'll notice your skin feels cleaner, smells fresher, and you won't have to worry about whether others notice your odor before you speak. 2. Improve your diet. Let me ask you, have you noticed that some people seem to have a fresher scent than others, even without using fragrances? It's not a coincidence. What you consume influences how you smell. If you're over 60, your diet might be worsening the situation. Some foods increase the production of fatty acids in your body, and when combined with sweat and bacteria, they create a damp or slightly acidic odor. The main culprits: prohibited processed foods, prohibited fried foods, prohibited excessive red meat consumption. These foods increase oxidative stress in your body, indicating that your body is having trouble processing toxins. And how do those toxins escape? Through the skin. Before we continue, remember to like the video if you're enjoying it, and subscribe to the channel for the best tips on how to attract abundance and prosperity into your life. Let's move on. How to fix it. It's important to include foods in your diet that fight bad odors from the inside. Heavy checkmark green leafy vegetables, such as spinach, kale, and parsley that contain chlorophyll, a natural deodorant that helps eliminate toxins before they reach your skin. Heavy checkmark citrus fruits, such as oranges, lemons, and grapefruits, they purify the body and leave a fresh feeling on the skin. Heavy checkmark foods high in antioxidants, such as berries, nuts, and green tea, they combat oxidative stress and reduce the generation of oils that can cause bad odors. Practical tip: every morning, drink warm water with lemon. This helps eliminate toxins, improves digestion, and prevents body odor from the start of the day. 3. Change your sheets and clothes more frequently. You might be surprised, but odor isn't just limited to your skin. It's also present in your clothes, sheets, and pillows. Nonenal, the compound responsible for this smell, doesn't just stay on the skin, also clings to the fibers of fabrics. The most frustrating part is that regular washing doesn't always completely remove it. This means that even if you shower, you might still be wearing clothes or lie on sheets that hold on to that odor. Solution: bed wash your sheets at least once a week. You spend several hours in bed each night, and during that time, your body releases sweat, oils, and dead cells. If you only wash them every 2 weeks or less, you're essentially sleeping on a buildup of bacteria that causes unpleasant odors. T-shirt change clothes more often, especially those in direct contact with your skin. Underwear, t-shirts, and pajamas should be washed after each use. Extra: use white vinegar or baking soda during the wash to remove nonenal residues in clothing. Persistent bad odors in your bedding can be an inconvenience, so it's recommended to wash your sheets at least twice a week, and don't forget the pillowcases. Your head, neck, and face are in direct contact with them, and if they aren't kept fresh, you'll only be intensifying the odor on your skin. Now, let's talk about clothing. Nonenal tend to adhere to fabrics, though some hold onto it more than others. If you wear many garments made from synthetic materials like polyester or nylon, you're making the problem worse. These fabrics don't allow for good breathability, causing the odor to get trapped and persist even after washing. Opt for more breathable fabrics like cotton and linen, which allow air circulation and don't retain odors as much. Here's a little-known laundry tip. Detergent alone isn't enough. Conventional laundry soap doesn't effectively remove nonenal. So sometimes, even after washing your clothes and sheets, they won't smell completely fresh. One option is to add white vinegar to the wash. Vinegar acts as a natural deodorizer that breaks down the odor-causing molecules instead of just masking them. You just need to pour about half a cup into the softener compartment or add it directly during the rinse cycle, and you'll see a big improvement. This small adjustment, washing your bedding and clothing more frequently, opting for the right fabrics, and adding vinegar to the wash, can completely eliminate that annoying odor. You'll wake up feeling refreshed, your clothes will smell fresher, and most importantly, you won't carry that bad smell throughout the day. Step 4. Stay hydrated and detoxify your skin. Let me ask you a question. How much water have you consumed today? If you're like many people, you probably haven't drunk enough, and that can be a serious problem. If your body can't efficiently eliminate toxins, what do you think happens? They start coming out through your skin. That peculiar odor you notice after 60 isn't just sweat. It's the toxins that have accumulated and haven't been expelled by your body. When you're dehydrated, your body operates more slowly, and waste isn't eliminated properly, staying trapped in your system. Instead of disappearing, these compounds are released through your pores. That's why, no matter how many showers you take, the bad odor keeps appearing. What should you do? First, make sure you're consuming at least 8 glasses of water every day. And not just any kind of beverage. Clear, pure water. Coffee, soda, and sugary drinks actually worsen dehydration. Your body needs clean water to flush out the toxins before they're released through your skin. If you want to speed up the detoxification process even more, don't settle for just plain water. Add lemon. Lemon water helps your liver eliminate waste more quickly, preventing odor-causing compounds from staying in your system. A great supplement is green tea, rich in antioxidants, which helps your body break down fats and oils more efficiently, reducing the amount of odor released through sweat. Now, let's talk about something that often goes unnoticed: your skin. If you don't exfoliate your body, you allow layers of dead cells, sweat, and natural oils to accumulate, which traps bad odors like a sponge. That's why it's important to exfoliate at least once a week. Use a loofah, a dry brush, or a gentle scrub before your shower. This will remove the dead cells where the odor-causing compounds accumulate, allowing your skin to breathe and stay fresh longer. In summary, to eliminate bad odor permanently, it's important to tackle it from the inside. Increase your water intake. Choose lemon water or green tea, and exfoliate your skin frequently. By doing this, you'll not only enjoy a fresher scent, but also experience a sense of lightness, increased vitality, and even a more youthful appearance. Step 5. Use a natural deodorant with antioxidants. Let's be honest. If your deodorant were truly effective, you wouldn't be dealing with that bad odor over and over again, right? You apply in the morning, and by noon, bam, the odor is back. This happens because conventional deodorants don't eliminate the bad odor. They just try to mask it, and that's no longer enough after 60. The issue isn't just sweat, though. There's a more complex factor, nonenal, a substance that builds up on the skin over time. Regular deodorants can't break it down. So even when applied, that rancid, somewhat oily smell persists. The answer lies in a deodorant that contains natural antioxidants. It's not just about masking the bad odor, but eliminating it from its source to prevent it from coming back. Choose deodorants that include vitamin C, eucalyptus, or witch hazel. These ingredients help break down the substances that cause bad odor and keep your skin fresh for longer. These aren't just fancy ingredients. They truly work. Vitamin C helps break down the fatty acids responsible for nonenal, preventing them from sticking to the skin and causing odor. Eucalyptus eliminates the bacteria that intensify the odor, keeping you fresh for longer. Witch hazel works as a natural skin toner, reducing pore size and regulating oil production, which results in an overall reduction in odor. If you continue using traditional deodorants with synthetic fragrances, aluminum, and parabens, you might actually be making the problem worse. These chemicals can block your pores and trap nonenal, making it harder to get rid of the bad odor. That's why switching to a natural deodorant can be a real game changer. Also, how you apply it is crucial. Here's what you should do. Apply the product immediately after showering, while your skin is still slightly damp. This helps it absorb better and prolongs its effectiveness. Use only a small amount. Natural deodorants interact with your body, so you don't need to apply much. A small amount is enough. If necessary, reapply, especially after exercise or on hot days. By making this adjustment, you'll experience something surprising. You won't need to constantly reapply deodorant. The reason? Your body will stop generating that bad odor in the first place. So, instead of just covering up the problem, address the cause. If, in addition to this, you stay hydrated, follow a balanced diet, wash your sheets regularly, and exfoliate your skin, you'll wake up feeling renewed, confident, and free of unpleasant odors. If you've noticed a change in your body odor after 60, don't panic. It's completely normal. However, it's also a sign that your body might need a bit more attention. By changing your soap, improving your diet, washing your clothes regularly, staying well hydrated, and using a natural deodorant, you can get rid of that odor and feel fresh, confident, and healthy every day. Let me know in the comments if you've ever noticed this scent and what's worked for you. I'd love to hear about your experience. Thanks for watching the video. See you in the next one.